My name is Brenda. I'm going to be your student nurse practitioner that is evaluating you today. How are you?
Very well, thank you. I'm Mr. T.
And what are you here for?
I am needing a yearly physical examination.
Okay. Do you mind if I take a few notes?
No, not at all.
All right. Can you tell me what you do for a living?
I am a police officer.
Okay. Do you work for the city of Austin or?
I do.
Okay. And do you have any allergies, drug allergies or seasonal allergies?
No, kind of.
Kind of drug allergies?
No, I have no drug allergies.
Okay. What about seasonal?
Yeah, ish.
Pollen,
Yeah, I don't.
cedar.
Yeah, I think like a little bit of it. I don't know about mold. I don't really get around mold.
Do you take medications for your seasonal allergies?
Just over the counter.
Okay. What do you take?
What, some Zyrtec, some
Okay.
Claritin. Maybe a little combination thereof.
Okay. Do you take any other daily medications?
Yes.
What do you take?
Levothyroxine,
Do you know how much?
125.
Is there any other ones you take?
I take Excedrin, migraines, pretty regular.
Okay. How often do you take those?
Probably daily.
Do you know how much you take?
A lot.
Like 500 milligrams? One
Probably
tablet?
probably 600 or 800 for the course of the day.
Okay.
It depends on, I get headaches regular, I get migraines a lot, so it depends.
Okay.
I'm just getting a headache, probably around 400. If it's really strong, really coming on, I'll probably up it to maybe 6.
Okay. We will talk about your headaches here in just a few minutes. And are there any other medications besides the levothyroxine and Excedrin or Zyrtec allergy medicines? Any over-the-counter vitamins that you take?
Yes,
What?
I take vitamins.
Okay, like do you take a vitamin D pill or do you take a multivitamin?
I've taken a vitamin D pill.
Okay.
That's been prescribed before. I don't take it anymore.
No. Okay. Was it prescribed? Have you had your levels checked and they came up, and that's why you're no longer taking them?
No, it's because I ran out,
Okay. And you.
and I haven't had them rechecked. So we should do that.
Okay. That can be something we do. And you said you take a multivitamin, correct?
Yes, I do. I take a Flintstone,
Do you
several.
2 or 3 of those then?
Yeah, easy. It's kind of like eating candy.
Okay. Childhood immunizations. Do you know if you got all of those?
Yes.
And what about adult immunizations?
Yes.
All caught up. All
Yes.
right. Did you have any childhood illnesses?
No.
Did you have the chicken pox?
Yes.
You did?
Yes.
When did you have those?
I was 18.
Okay, you got those later on in life. What about any adult illnesses or injuries?
No.
We'll start with illnesses.
I had walking pneumonia
Okay.
a year ago.
Do you know how long it lasted?
I had symptoms for a couple months. We finally got it diagnosed.
Okay. And did you have any re in the hospital with that?
No.
No hospitalizations?
No.
Any other hospitalizations?
When
Any time in your adult?
in my adult life,
Mm-hmm.
yeah, a few times.
Okay. What were you hospitalized for?
Migraines. Let's see. I hurt my knees at work. That was only but see, I was just taken to the hospital, so I really wasn't hospitalized.
Okay.
So to me, that's a little bit different.
So you have been hospitalized for your migraines in the past, though?
Yeah, I actually think I got released. I was in the ER.
Okay. And did they do an MRI or any CAT scans or anything
Yes.
on you at the time?
Yes.
And did they have any findings with those?
No.
Any other hospitalizations, car wrecks, injuries?
Oh, yeah, car wreck.
Okay.
Yep, in 07.
Okay.
I can't remember if I was there for a day or not. Maybe I got released. I don't know.
Okay. Let's talk a little bit about your personal, any diagnosis of high blood pressure, high cholesterol, diabetes, any heart problems.
Nope.
Okay, let's talk about some family history. What about your mom? Any diagnosis that you know of?
Yeah, she's diabetes, high blood pressure, sickly.
Okay, so diabetes and high blood pressure.
Yep.
Anything else?
I don't know. She got problems with her feet.
Problems with her feet, like they tingle. She can't feel them.
I don't know. They're not my feet.
Okay. What about your dad?
Congestive heart failure, overweight. He's way overstressed.
Okay. Do you have any siblings?
5.
Okay. How many sisters do you have?
4.
4 sisters. And that would be 1 brother.
Yes.
And does your brother have any symptoms that you know of?
No.
Okay. And any of your sisters, any symptoms that you're aware of? Diagnosis?
I think one sister's actually crazy.
Okay.
No, I'm just kidding on that one.
Okay.
Maybe Amanda. No, I'm aware of. I mean, I got.
None of them have diabetes.
I don't know.
You're aware none of them have congestive heart failure.
No.
Okay.
I think one's got severe anxiety problems.
Okay.
Yeah, she has to because she's always talking about it.
And this is your sister, you said Amanda?
No, Amanda's just crazy.
Okay. Let's talk about your mom's mother. Do you know if she has anything?
No, she's very old.
Okay. Is she still alive?
Yeah.
Okay. But no diagnosis that you're aware of?
No.
And what about your mom's father? Is he still alive?
Yes, he's very old too.
Okay. And do you know of any diagnosis with him?
No.
Okay. What about your dad's mother? Do you know?
She's alive.
She's alive?
She's old.
And your dad's father?
I don't know.
Don't know if he's alive?
No.
Okay. Do you have any kids?
Yeah.
How many kids do you
7.
have? Do your 7 children have any diagnosis?
I know it's a lot of kids.
Dude.
I'm sorry. It's such a random question.
Do they have any diagnosis?
Yeah, my 2 oldest have severe ADHD.
Are they male or female?
They're both female. I think they have some other psychological stuff. We don't know. We're doing ongoing testing with them.
Okay.
I have another daughter that has a bone disease, and then everybody else is healthy.
Okay. So you have how many daughters?
6.
And 1 son?
Yeah.
Wow. Is the boy the oldest or the youngest?
Youngest. He's the baby.
Okay. Okay. So let's talk a little bit about you. And do you exercise?
Daily.
Daily. Okay. About how often?
Like all the time.
For how many minutes?
All day. That's what I do at work.
Okay. Are you on walking patrol at work?
Yes.
Okay. All right. And you carry around all that added equipment.
Yeah.
So, okay. Do you smoke?
No.
What about alcohol intake?
No.
None at all?
None.
Okay. What about drug use?
No.
What about prior drug use?
No.
No?
None.
Okay. What about caffeine? Drinks, sodas, tea?
I drink tea all day long.
Okay.
Morning till bed.
Okay. What about water?
And water. Well, tea's mainly water.
Okay. What about your weight? Do you have any issues with your weight?
I'm a solid 195 pounds.
Okay. No changes, no fluctuation, weight gain, weight loss, unexpected.
No, it's pretty steady. It's been this way for about a year and a half.
Okay. And do you have a religious preference?
Whatever my wife wants.
What does your wife want?
Baptist.
Okay. And are you currently sexually active?
Yes.
Okay. We have any problems with erections or
No.
okay, any testicular pain?
No.
Okay. And have you been tested for STDs at any time?
No. Not specific. No.
Okay.
I've never had an STD ever.
Okay. Have you ever been tested?
Well, I think you kind of have to have one to get tested for one, right?
You may not know that you have one if you've never been tested.
Well, what are some symptoms of an STD? Because I've always been pretty normal.
Okay.
I'm just throwing that out there. And I've had the same partner for 20 years.
Okay. Well, that makes perfect sense then.
Okay.
Do you have any fevers or chills?
No.
Tiredness?
Yeah, I get tired.
Is it just kind of your normal tired because of life or?
Probably.
Okay. Nothing
I mean, a
out
wife,
of the ordinary.
a dog, 7 kids.
Nothing out of the ordinary
Job,
that
no.
puts you down for multiple days.
No, I have migraines.
Correct, but not the tiredness.
No.
Okay. And then the migraines that we were talking about, you said that you've had an MRI in the past from the doctors.
Yep.
And does the Excedrin that you take help?
Yeah, sometimes if I catch it early enough.
Okay.
And a lot of it, there's other factors that go along with that too. I have to shut a lot of stuff out. I have to limit my sunlight, background noise, distractions, things like that. Like I have to severely de-stress. And that's to curb it. Sometimes it just doesn't go away, but it's manageable. So you just deal with it because it's so routine. It's always there. You just deal with it pretty regular.
Have you been referred to a neurologist in the past?
Yes.
Okay. And were they able to determine anything?
No. They just wanted to medicate me up, and I respectfully declined that.
Okay. Where are your headaches normally? Are they in a central location or
It depends.
all over?
Sometimes I get them here. I get them here. Sometimes I get them here. Sometimes it's just, my whole head is like just a big drum.
Okay. Is it a throbbing headache, an aching headache, a stabbing?
It really depends. Depends on when I catch it. I think. There's other factors. Sometimes it can be like a very sharp pain, so it'll almost split your noggin. And then other times it's almost like you're being compressed with a vice. So I think it just really depends.
Do you find that anything helps the headaches, or let's ask this question first. Do you find that anything triggers your headaches more than another, whether it be light or sound or possible allergies?
Waking up in the morning generally triggers it.
Okay. Stress, does it increase
I don't think so.
the frequency?
I don't get stressed out that much.
Okay.
No, a lot of things stress me.
Okay. Do you have any vision problems outside of your headaches? You wear glasses?
Oh yeah, I wear glasses, but only for nighttime driving.
Okay.
It's not, and I still have 20/20 vision.
When was your last vision exam?
Less than a year ago.
So no blurry vision?
Nope.
Okay. Now with your headaches, do you have any vision problems?
I don't know.
Blurry vision, double vision?
Not generally speaking. Sometimes it becomes overwhelming. So, it might be hard to look at certain things, especially when we talk about light and things like that. So, I don't know. You just have to put that in your own words. I don't really have a great answer for that one.
Okay. Do you use anything to block the sun? Do you wear sunglasses? Does that help?
Oh, sunglasses are religious until the sun is down.
Okay.
I can't function without them.
So you have a lot of light sensitivity?
Mhm.
Okay. What about your hearing? How's your hearing?
It depends. If you ask my wife, she would say that I'm hard of hearing. If you ask me, I say I hear just fine.
Have you had a hearing exam?
No.
Okay.
However, I think there are certain tones that I may not hear
Okay. Do you ever have any ringing of your ears?
all the time.
Okay. Do you ever have any equilibrium problems, or you kind of feel off balance,
There
dizziness?
are on occasion.
Do you have any sinus problems?
Yes,
Sinus.
I get sinus infections yearly, 3 to 4 times.
3 to 4 times a year.
Yeah.
What do you normally take to help
I-
with those?
I go
Do
to
you
the
go
doc.
to the doctor?
Yeah, and then I gotta argue with them, and it takes 3 hours to get a prescription.
Do they normally give you like a Z-Pack, an antibiotic?
Yeah,
Something you gotta
antibiotic.
take multiple.
Yeah.
Okay. Does that normally help?
Yeah, I mean, after a week.
Okay. With that sinus infections, do you have to stay out of work?
Sometimes,
Okay.
if I catch it early enough, I can kind of maybe muster through it. If I don't, I'm out. I'm out for a week.
Okay. Do you have any breathing troubles? Coughing, wheezing?
Nope.
No sputum production?
I don't even know where sputum is.
Spit?
No, I spit just fine.
Do you have any chest pain? Heart palpitations?
What's palpation?
You feel like your heart's kind of beating out of your chest?
No. The only time I ever experienced that is when I met my wife for the very first time.
That's very nice.
It was nice. It is nice.
Appetite. You eat good?
I really.
You picky? Are you getting your vegetables?
I eat lots of
What
vegetables.
about your fruit?
I eat fruits.
Okay. No nausea, vomiting?
Nope.
Bowel movements? Are they
Regular.
regular? Daily?
Oh yeah.
No.
I take that very serious.
No change in color
Nope.
patterns?
No,
Okay.
they're all pretty much the same color.
Okay. And how's your urinating? Do we have any problems with that?
Nope. Been doing it for 41 years. Got it down.
Okay.
And no, there's no problem.
No change in color, smell?
Nope.
Okay.
Depends on if you're hydrated or not.
Okay. What about joint pain? Do you have any joint pain?
Yes.
Stiffness?
Yep.
Where at?
My knees,
Okay.
my shoulders,
Okay.
my hand,
You have joint pains in your hand?
stiffness,
Stiffness?
and joint pain in this finger,
Okay. What is that from? Do you
arthritis.
know? Arthritis?
Yeah, this is from probably shooting a million rounds out of a gun, probably.
Okay. Have you seen a doctor that diagnosed you with arthritis?
Yes.
Okay. Do you know when you were diagnosed?
2008.
And you said it's probably from shooting a gun.
Mm-hmm.
What did you do before you were caught?
I was in the United States Army.
Okay. Thank you very much. So both with being in the Army and being a cop, you carried around a lot of gear on your back.
Yep, daily.
Have you had somebody relate that pain with your shoulders and your back pain and your knees?
Not specifically. I mean, yes and no. Everything appears to be normal. It could be pinched nerves. It could be things like that. It could just be normal wear and tear on my knees, as far as I don't know what you call it, the ligaments or tendons, whatever.
Mm-hmm.
The tread on them could just be getting worn out, which just causes them to ache and hurt sometimes.
Okay.
Other than that, we're strong like a bull.
Do you have to take any medication for that pain?
I don't.
Any anti-inflammatories?
No, I mean ibuprofen sometimes, but I think that probably just comes along with the headaches as well.
Okay.
Mainly, the only thing I ever really truly treat is just my headaches. Everything else I just deal with.
Okay. Let's see. Depression.
Nope.
Have you ever been diagnosed with depression?
Nope.
Do you have any mood changes?
No, not really. No.
No nervousness, tension?
I don't really get nervous. There's always tension at work, though.
Okay.
Yeah, it just comes with the job.
Yeah. Okay. All right. Then we will get moving on to our next exam, and we'll do a physical exam for you for your work.
Sounds good. Yeah.
Thank you very much.
No problem.